So for this video, we're discussing two muscle energy techniques that are oftentimes used as interventions following the identification of a concordant sign with anterior or posterior PIVM assessment about the SIJ and pelvis. So let's go ahead and get started. For this test, we need to angle our patient on the table. So we're going to bring their shoulders closer to us. This leg is just going to slide off the table a little bit. And this side we're presuming is kind of our painful side. Now typically you want to be on that side. However, so I don't block kind of the view of what's happening, I'm going to be on the opposite side for this test. At this point you're going to flex the opposite leg up and you're going to stabilize this leg here. The patient can push into you gently in just a moment when you give them the cue, but really your focus is on this side here. And so at this point we're ready to begin. We're going to ask the patient to gently try to bring their same leg that is painful into hip flexion while gently extending the opposite side, so it's this reciprocal motion. So let's begin with a gentle hold here. Ready and go. Hold, 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 and relax. Typically the hold is 3 to 5 seconds. You would do it several times and then reassess. Let's try it 2 more times. Ready, here we go, and hold, 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 and relax. You can see that the patient is getting that nice reciprocal activation on both sides, and that would be our anterior rotation muscle energy technique. Now, we're going to leave them in the same position, but we're going to presume that now the painful side is this right side. And so at this point, this leg can just kind of relax on the table. We're going to stabilize it, but they're not really going to use it too much. We want to facilitate as much hip flexion as we can on this side as is tolerable. And then once we get to the patient in this position, we can either use kind of our shoulder if they're a bigger patient and they can relax on us, or if they're a little bit smaller, we can just kind of come in and use our hand. But at this point, what we want to facilitate is getting this individual to activate hip extension while stabilizing on the opposite side. And so it would look very similar. Push into my hand here gently, hold, 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 and relax. Again, 3 to 5 second holds. We want to facilitate about 3 to 5 of these and then reassess. We'll do one more here. Push and hold, 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 and relax. Now an alternate position has been proposed for these. We're going to ask our patient to come into essentially a hook-lying position. And at this point, again, with these, we're really trying to engage or facilitate this reciprocal hip flexion and hip extension. And so the alternate position is actually to take either a bolster or your arm and place it through behind the knee and in front of the knee on the opposite side. And then what you would ask your patient to do is, the cue is typically, try to break my arm, right? Now they're not going to be able to, but they want to engage a fair amount of force here, and it's easier for you to stabilize in this position. So again, hip flexion would be facilitated on this side. We're presuming an anterior rotation muscle energy technique, hip extension on this side. So when you're ready, go. Go, 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 and relax. Significantly more muscle activation and force produced on that one. Your forearm will be fine. If you wanted to do it the opposite on a posterior rotation, that could also be done. You would facilitate from the opposite side and go at it from there. So have a go with these muscle energy techniques with a peer or colleague, and let me know if there's any questions.